Happy Friday, and thank you for taking the time to participate in today's webinar. My name is Jesus Azanza, and I am the Executive Director for the Greater Houston chapter of SAYOR. We had over 400 people register for today's webinar, which to me shows just how dedicated our industry is to ensuring our pools and residents are safe. We received nearly 20 questions in advance, and our presenters have incorporated many of those into the presentation. We're going to do our best to keep the presentation to an hour with Q&A, so if we don't get to your question in time, we'll follow up with you after the webinar. This information is changing by the minute. In fact, Harris County Judge Lena Hidalgo is hosting a news conference as we speak, and so we'll do our best to keep you updated with what comes of that. Full disclaimer, the information presented today is not legal or health advice. The presenters have put together a great slide deck based on their years of experience in the pool service industry, in addition to federal and state guidelines and available guidance, although somewhat vague, from the CDC, Health Department, and industry trade groups. The goal for today is to give you the information you need to make an educated decision on how to reopen or not reopen your pools. So please be sure to consult with your attorney, insurance provider, HOA board, community manager, and especially your pool company to develop a plan of action that best suits your community's needs. Before we begin, I'd like to bring your attention to the Q&A portion of this webinar. During the presentation, all your mics will be muted so you can use the chat feature, and we'll answer as many of your questions as we can at the end of the presentation. If you have a specific question regarding CAI's response to COVID-19, you can reach out to me or your respective chapter executive director. For more information, you can check out our website, caihouston.org. We've got a complete coronavirus resource page there. Quick introduction of today's presenters. Heather Dominy is president of A Beautiful Pools. Darlene Treat is director of client services at Sweetwater Pools. She is also the co-chair of our trade show committee and one of our chapter's bronze premium partners. Joshua Venghaus is president of DS Recreational Services. Lastly, the presentation will be recorded and distributed to everyone this afternoon. At the board's direction, our chapter has aggressively expanded its online learning and virtual networking program, so we hope you can continue to participate in future presentations. We've got a great lineup coming out. Now, before everyone starts to notice that I cut my own hair for this presentation, I think it looks not halfway bad, I'm going to hand the screen over to Heather. So Heather, take it away.
Sounds good. Thanks so much. Welcome, everybody. We're excited to have you here. Here's our first screen. And like Jesus said, I'm Heather, and we're going to hear from Josh next, and then Darlene will wrap it up, and then we'll take questions and answers. We're working on that chat being available for you guys to ask questions as they come up, and then we will sort through them and answer anything that's not addressed. Thank you so much for coming. Most of us are excited, but also concerned about opening our pools, and not concerned in a negative way, just to make sure that we've covered everything and that we're doing everything in the best interest of our residents, our HOAs, all of you, and our lifeguards. So basically, this is a presentation of considerations. When can we swim? Who will lifeguard? How can we do this safely? We're going to review some of the government laws, rules, and regulations, staff training, hiring, and recruiting, and then some of the health and safety concerns and recommendations for our lifeguards and our residents, as well as what we are looking at for operations. So that's kind of the way that we'll run through this presentation for you to have some expectations. Some of these can get a little wordy, but we also didn't want to leave anything out, so we had to find a balance. As Jesus said, we all recommend that managers and HOA board members should consult with their association attorney and insurance agents for clarity and guidance in anything discussed, or if you have specifics where you're wondering about your certain community. We look for our training agencies to help us make decisions, and we also look towards the Pool and Hot Tub Alliance, Texas Public Pool Council, Association of Aquatic Professionals. We look at IAPA, we look at World Water Park Association. Some of you are saying, well, I have a very small pool. And then some of you are saying, well, I've got a small mini water park. We're looking at all of those organizations, trades, and guidance, all those organizations, trades, and groups for guidance as how to move forward. We also heavily rely upon, for medical advice and recommendations, ILCOR, American Heart Association. We look towards the International Drowning Research Alliance, International Life-Saving Federations. Both of those groups have committed to having an update for lifeguards in the next several days. So we're excited to hear that information as well from them, as well as many other groups in terms of health and safety for our lifeguards and both our residents and operations. So as we move through here and you think to yourself, well, who said that? Well, why are we doing that? Well, who told us to do that? Know that we've all combined the information of all of those industry leaders and all of those safety experts to come up with what we believe is the next best steps for our pools. As Jesus said, this could change in 20 minutes. And so if one of these groups come out with their recommendations, then that's going to completely change potentially, what we have given advice over. We are looking for the CDC to come out with their recommendation for pools and spas by May 15th. And we'll talk a little bit later as to why Texas made the decision not to open pools in regards to that. So aquatic recreation in Texas. On April 27th, Governor Abbott issued Executive Order number GA-18, which was the first phase in Open Texas. He stated that people should avoid visiting bars, gyms, public swimming pools, interactive amusement venues such as bowling alleys, video arcades, massage establishments, tattoo studios, piercing studios, and cosmetology salons. This order, he stated, superseded any local official orders and in response to COVID. Abbott says that the second phase of reopening could come as soon as May 18th, as long as the state sees 2 weeks of data to confirm no flare-up. There's a couple links right here that we have, and please know that you don't have to take significant notes as we'll share this with all of you as well. But that link is to his order and the expanded document that he provided. So digging just a little bit deeper, the statement that is in the order and in writing says public swimming pools. And we've had a lot of questions this week, as has many in the industry, including our attorneys and insurance agents, public swimming pool and how that relates to our HOA facilities. When I reached out to the Texas Department of State Services for Health, State Health Services, I was told that pools should not be reopened. Anything outside of their backyard has not been given clearance for reopening. The Department of State Health Services website expanded the meaning of public pools to include aquatic recreation facilities. And in the industry, we look to that to mean splash pads, pools, water parks, water slides, any interactive water, swimming, or recreational facility. I'm gonna have a link to that website as well, where you can get that information. Kenneth with the City of Houston Health Department, when several of us reached out to him, stated that all pools besides private residents should be closed under the current state orders. So we had several people quote that. I did also reach out to the Harris County Health Department and haven't gotten a response, as they had several meetings this week to discuss this. We also want to note that when we talk about pool and swimming and water recreation, it's so wide, it's so vast. So we're looking at oceans, we're looking at, oh, that was inserted in the wrong spot, but we're looking at oceans, we're looking at open water recreation, water parks, municipalities, HOAs, communities, their aquatic recreation, apartments, hotels, splash pads. We've got gyms included in that, as well as aquatic therapy facilities, lagoons, and many more. There will not be a one-size-fits-all solution to reopening. They're not going to be able to address each issue as well. And so we're looking towards our operators, our industry leaders, and local officials for specific guidance when needed. This is the email snippet that I have provided from Katie Moore, and she is with the Texas Department of State Health Services. Basically, she said pools are not reopened, and this was specifically asking for our HOA and community association facilities. Essential services and specific facilities listed in the governor's orders are reopened with restrictions. Pools are not specifically opened. In the order that I provided the link to, she asked us to reference pages 2, 3, and 4. Additionally, if we just jump forward a little bit, she has stated that there is no sanitation protocols for pools from either the CDC or the Texas Department of State Health Services that are necessary for businesses to reopen. And so as we see these businesses reopening, the CDC has recommendations as to what to do when they do so. And since the CDC has stated they will have that for pools by May 15th, the state of Texas is probably waiting to reference that and how they're gonna move forward with opening their pools. So that was kind of interesting to me because they're wanting to have a good plan for us in Texas, which is awesome. But those are the two things that it seems like she referenced we were waiting on. I also want to note in this area, many states, as I've done research, have waited for pools to open in later phases. Not many of them are opening in the first several phases. And I think everybody's looking for the CDC to make those recommendations. The second phase, I emphasized could here. The second phase of Open Texas could come as soon as May 18th. I put the details here as to what Governor Abbott stated. Many of you are aware of them, but we need to see 2 weeks of good data. We have to make sure that our hospital has capacity for COVID cases. Also, I want to note that he noted that counties could move forward or back phases based on our community data, and we need to be aware of that. He did discuss specifically, but didn't use the word pools, that bars, gyms, hair salons, and other businesses he hopes to see open in the next phases, and he used the term mid-May. The last sentence of Katie Moore's email on that previous screen said, perhaps May 18th. So throughout this presentation, if we reference May 18th in regards to pool opening, it's a perhaps. And in terms of pool management companies, we see that date as a date where we can start getting our lifeguards in the water to train. We'll talk about our recruiting and training efforts and how those were halted in some later slides. So just keep that in mind when we reference that May 18th date. Pool opening expectations on current Open Texas directives. We are looking for them to include reduced capacity as well as social distancing, just to follow that same pattern of behavior and how they're opening other businesses. Just to reiterate, because there's so many questions concerning this topic, but wait, HOA pools are private. We've spoken to industry leaders in both management companies, local and state government, and pool companies, and we believe that while an HOA is privately owned location, their pool in their common area, for the purpose of Governor Abbott's order, we believe that he was referencing anything outside of your private residence. Swimmers who visit the pool, splash pad, or water recreational area will be from multiple households to socialize, swim, and congregate. Several states, as I noted in the other slide, have moved their pools and their water recreation into the later phases of opening, awaiting CDC and state recommendations. I'm going to pass this over to Josh right now for him to pick up.
Thank you, Heather. One of the, I guess, the hesitations that we have for opening has been staff recruiting, hiring, and training. And as the slide says, you know, I get the joke sometimes, well, you guys are in the off season, you're not doing anything, but really our off season starts pretty much as soon as the pools close. We start to reach out to those kids that worked for us the year before, get out emails, rehire letters, and like DS, like the other companies, we start training as soon as we can, February usually. And our training was going pretty well this year. Recruiting was going pretty well. And then, of course, COVID hit us. And the second slide says efforts for recruiting were abruptly halted when schools closed for the year. I know for us, the week that school was closed, we had 10 high school visits. We recruit the high school lunches where they let us. And so that avenue was completely closed down for us. Right now, 60% or 70% of more lifeguards are hired between March and June. And as you know, March has not been able to happen, and April hasn't either. And it looks like, you know, parts of May will not as well. A lot of pool companies are continuing to recruit through word of mouth, social media, but the rate is down. When we would normally, a lot of pools would open this weekend, of course. So if you're a company that has 400 lifeguards, right now you might be lucky to have 80 to 100 hired, and maybe even less than that trained. Lifeguards and pool monitors are being hired virtually by video submissions and online interviews. Our office closed probably about March 24th, but we were still taking applications the entire time through online, and then we switched our interviews over to online as well. As again, lifeguard training courses stopped in the Houston area week of March 16th. Of course, we could not continue to do classes. I know that I know at least these three companies we communicated. I think we pushed it to the very last weekend that we could. I know some of the local fire departments and hospitals had already stopped their CPR about 2 or 3 days before we did, and we said, well, we've got one more class, let's get it in, and we did that. Many training agencies are releasing information, guidelines, and best practice for lifeguard and facility management during COVID-19. So those agencies, like such as Red Cross, Ellison Associates, StarGuard, those are companies who give our lifeguards a certification and give us direction on what we'll do with this new crisis. And that a lot of that information was just, well, it had to be developed and it was released to us over this past week. Houston area pool management companies need to train hundreds of lifeguards before the season. Many of us utilize blended learning. Blended learning is an online-based learning that we can do for much of the first aid and CPR training. However, the lifeguard skills, and we'll talk about that more, all of that is very hands-on, rescuing someone from the top of the pool, the bottom of the pool, extricating with a spine board. These are skills that take multiple rescuers to perform. And in doing that, we can't gather these kids together to do that. They're in very close proximity. Again, we're utilizing blended learning online. There's just not any in-person practical training needed for lifeguards to become certified. And again, the Red Cross came out this week, StarGuard and both Ellis, and they've all said there's not a way right now to utilize social distancing for the lifeguard training at this time. Recommendations for life-saving skills for professional rescuers guided by medical doctors and international medical guidelines. So those organizations such as American Heart, American Medical Association, those are the ones that guide our certification classes as well. Social distancing, personal protective equipment, and restrictions on number of people have limited the availability to train lifeguards, as I've mentioned, as well as pool closures. You know, even if we could train at the time, if the Red Cross would allow us, early in the season, a lot of us use indoor natatoriums, the high schools, and of course those were closed. So that closed that. Staff training needed COVID-19 protocols, cleaning and mitigation, as well as mental health training for lifeguards. And again, I think all three of the major agencies have updated that training. So we'll be implementing that as soon as we're able to do that with the lifeguards, meet with them again. Pool management companies will need approximately 3 to 4 weeks to complete hiring and lifeguard training based on specific hiring and training lifeguard numbers. So just keep in mind, if we are set to train, if we're allowed to train, as we hope we will in phase 2, that doesn't mean that the pools will open May 19th. I think that on a case-by-case basis, you know, we're looking at 3 to 4 weeks. So if you expand that from May 18th, I mean, anywhere from first part of June to get those numbers where we're at, where we need to get them to. Dr. Justin Simprot with StarGuard Lee explaining the management of COVID-19 in the healthcare industry as the hammer in the dance. Heather, can you want to go through that one, because that was
Yeah, absolutely. Oh, and now I might have to go back a second. Hang on just a second. Sorry about that. So A Beautiful Pools utilizes StarGuard to do their training, and it was a pretty interesting concept. He said the hammer was the first 6 to 7 weeks where everything was closed. Everything was shut down. We came down really hard with the hammer, and we just shut everything down. And that's what we're experiencing right now, is our trouble getting back to it and opening up. He said the next, this sadly made me kind of take a gulp of air in, but he said the next 2 to 3 years is what we're going to consider the dance. We're going to try things, and we're going to see how those things that we try work, and whether or not it mitigates and reduces the stress on our medical system as far as people that are severely ill with COVID. So in that, there's always the potential that we're going to try something that might not work, and those things might be changed. So it was just kind of an interesting visual when you thought about it that I wanted to share.
Thanks. We're currently in a time period where there's a controlled spread of COVID-19 to avoid overwhelming the medical system. That's the goal. And of course, we've watched the news. We don't feel this cannot be eradicated right now. However, the spread is what we're concerned with. We cannot eliminate the risk of COVID-19, but we can mitigate that risk and reduce exposures for the lifeguards, staff, and residents. Currently, the U.S. is in a crisis level standard of care. This allows for things such as masks being reused, additional masks being approved for use in place of N95, modifications to ventilators if needed, et cetera. One of the questions later we'll address is, can lifeguards do CPR? That's one of the things that we're looking at doing, modifying those ventilators. This level will not last forever. We will move back to normal level standard of care, but it's what we're in right now.
Oh, wait, sorry. Went too far.
Next slide.
There we go.
Preseason is where we're at right now, oddly enough, because normally we're in preseason in March. So it's been quite a change. I've been with DS for 22 years, and although this has been a stressful time, I've been able to do some things that I normally wouldn't have done because we don't have 50 pools open or so. So we're in preseason right now. Again, this is the longest preseason ever. We can't halt preparations for a normal pool season to begin this summer. If your community feels like you're going to close for the entire summer, I would say it's probably number one, premature. So we have to push on. Again, we're still hiring, onboarding, training, doing orientations for staffs. A lot of those have been set up with DS and Google Classrooms and things that we normally would teach on site. We're doing online now. Pool supply and equipment walkthrough for both quantity and function. Rescue tubes, that inventory, any kind of. Oops, I lost my screen. Hang on. I lost my screen. Why is that? Hold on.
We are still getting used to virtual learning.
Hold on. Oh, well, okay, I have.
Do you see anything?
No.
Do you want me to pick
Okay,
up real fast?
I'll keep going. I'll start.
Okay.
Yeah, go ahead. Yeah, sorry.
We leave off additional facility supplies in preparation for COVID. We are still looking into the CDC health recommendations, but there will be signage that we will have to be required at the pools, most likely on the front of your gate. The next slide will have some samples of those. Please don't start printing or mass printing and start posting yet, because we still need to clarify we have everything that needs to be on the sign. Hold on. Ground markings for social distancing. We will talk about it during the phases of when we open the pool, but possibly having ground markings for where the chairs are going to be or where people can stand in the facility. Some amenities will have to be closed depending on what you have at your facility, possibly slides, diving boards, anything that could have a virus sit on it. Cleaning and storing furniture based on social distancing for each facility. We're going to talk about that in the different phases, and possibly having additional disinfecting equipment.
You back, Josh?
I'm back. Yeah, sorry.
Okay.
Cool.
Okay.
There's
These are some of the visuals of the signage that might be recommended for the facilities when they open. Visitor alert would be, of course, posted at the front gate. I believe we have links for those signs later, right, Heather?
I didn't link them specifically. I just wanted to caution about, we've been cautioned not to purchase yet. We need to wait for the CDC.
Yeah, sure. Yeah.
Good
For
example
CDC on May 15th. If those of you have been shopping HEB, you've seen the footsteps where, you can't approach the counters and things like that. Mask warning, and then the warning disclaimer for COVID-19 pandemic. Just a sample of some of those signs that might be asked to be installed.
Josh, you still got this one.
Yeah, am I okay? So, preseason again. Communicate with association and attorneys. I'm sure a lot of you have. I know I've spoken to some of you, and the attorneys might have a different opinion than what we do. Those are the legal experts, and we always defer to them in situations like this. Communicate with residents through email blasts, websites, mailers, etc. Include information on pool opening if you know that. I know that's hard to pinpoint right now, of course, for all of us. Communicate health status to attend the pool when open. Removal of lost and found, changes to guest pool party and swim lesson policies. Mask and social distancing requirements while at the pool, drowning prevention. And again, a lot of these things are going to be updated as of May 15th. But some of these, as far as to avoid getting 1,000 calls, if your pool is going to open Saturday, send out that e-blast now. And unless someone's been living under a rock, I think they would understand. But use those e-blasts. Include now hiring lifeguards flyers for community pool companies to help with continued recruiting efforts. We've reached out to all of our communities and asked if we can advertise in their newsletters. Another thing that we're all in this together, and we want to get the pools open. If normally we have communities that don't allow signs on the gates or banners, we've actually had some of those that have reached out to us and say, "Hey guys, do whatever you can," even as much as putting banners at the entry of the neighborhood. That's been allowed, and that's really going to help us get these kids in and get them trained as soon as we can. Also allow for pool space. I think everybody's been gracious enough where when we need our in-service training, our lifeguard training, the pools are open. We've had in the past maybe one or two that hey, we don't want all these kids here, but this is an extreme situation. So if you can, make sure you communicate with your boards, and the pool company should communicate with you as well that they'll be using the pool that day. One of the things that we've talked about is, even if we could train right now, we would have to be very careful about, residents driving by and seeing 40 people in the pool. And why can we train lifeguards there, and why can we not swim? So communication will be key on doing that. If your pool is being used for lifeguard training, that might be another instance where you send out an e-blast. It's no fun when mom loads up the wagon and 4 kids and the lunches and sippy cups and gets all the way there and she finds out they can't swim. It's not a good thing. With your pool company, determine the pool capacity to be reduced, prepare to be reduced bather load. As with, again, we'll defer to CDC when we get there, but right now that looks like 25%, at least in restaurants. And then later on the phases that we'll explain how that might change. And finally, open pools after local and state government allow. There's a lot of hands in this regulation, and if you remember, after 9/11, with flights were changed dramatically, and the Homeland Security was basically developed out of that tragedy. So this is kind of the same issue. We've got a lot of hands in determining when we can do and what we can do, and we just have to work through and get through all of those different channels before we can determine the actual plan for opening and operating.
Is this my slide?
I think so.
Operation and pre-season pool preparation. Many have asked about swim teams. We have a lot of swim teams that have already canceled their season due to the social distancing numbers. Delaying or adjusting the competitive aspect of the season. Swim teams that are able to successfully adhere to the local and state and health safety recommendations should be considered for pool access. They need to consider capacity guidelines. You'll see in the next phases on the next slides, we're going to tell you the next phases of pool opening, which will have capacity guidelines for each pool. You'll have to adhere to the social distancing, possibly health screening going into the pool, wearing masks, disinfecting protocols of door handles, bathrooms, handrails, limited touch services. That's why we're suggesting possibly not having furniture at the pool or limited supply. Having hand sanitizer stations and washing stations, which we all know currently we can provide, but they're all on back order. It's hard to find a lot of these supplies that are going to be needed for pool season. Post-exposure plan, if someone gets sick at the pool, example, lifeguards, cleaning crew, how are we going to handle that? Additional and future CDC recommendations. And then USA Swimming did release that they're going to try virtual competitions online. So that's something they can do, but most swim teams currently have started canceling. Pool season, bather load capacity. Does this require additional lifeguards at the gate? You'll probably have to get with your pool company to decide on each pool because each facility will possibly be different. They all can't run exactly the same. Health status. It's been brought up that do we need to start checking and asking people's health before going into the pool? Is there going to be questions we need to ask them? Or will the signs posted at the front gate cover everything that we need? Just like when you go to the grocery store, I mean, they're not asking you if you're sick, but then if you go to the doctor's office and we are considered first responders, they are asking those questions. So it's something to consider. COVID-19 specific waivers, should we consider having swimmers fill those out? That's something we need to push to our attorneys and ask for recommendation on that. Social distancing needing during operation. The lifeguard's primary responsibility will be in charge of patron surveillance. They will not constantly be able to monitor who belongs to which family. Are they staying 6 feet apart? So that's kind of why we need to have stuff on the decks and on the ground, and we need signs and help from HOA to help enforce that. Face coverings for bathers. We will probably be asking people that come to the pool to wear face coverings, obviously not while they're swimming in the water because they will need to breathe, but outside of the water, if they're just sunbathing, then we will be asking them to wear them. Possibly, sorry, it's not mandatory. Chlorine levels, pH, and cyanuric levels do we need to increase this frequently? What happens if you don't have lifeguards? Who's going to test those and how often? Next slide. We also need to develop a post-exposure plan if lifeguards or residents become sick and has symptoms while at the pool. Potentially closure due to exposure or quarantine or self-quarantine of the staff. Disinfecting protocols for restrooms, common areas, furniture, high-touch areas. These include your rock wall, your high slides, lifeguard stations, the chairs that they're sitting in, rescue tubes, lazy river tubes, and entry tables. We've even possibly looked at your sign-in books at the front of your entrances, possibly doing away with that because it's one extra object that they have to touch. Consider develop the care protocol if someone has COVID-19 symptoms while at the pool or needs emergency care. We will possibly have to have emergency PPE kits needed with N95 masks, gown, goggles, viral filters, and additional gloves. The additional gloves will definitely be something we will have to provide for all lifeguards and our staff this year. Health status is important as lifeguards should not be Health status is important as lifeguards should not be providing care to individuals with suspected or known COVID-19 cases. That will be the first topic of every lifeguard's parent as they ask, well, if my child goes to the pool, how are you going to guarantee that they don't get it or they're going to take care of somebody that possibly does have COVID-19? So that's something we have to address as well and be concerned about. Next. Disinfecting and hand sanitizing products or stations at the entries, restrooms, and other high-touch areas. We are highly recommending having these. Of course, the main thing to do is to wash your hands, but having hand sanitizer stations is a recommendation. Expect additional guidance from the CDC and local, state, and government for pool operations that will generate additional and adjusted operational protocols. Swim at your own rules. Swim at your own risk pools and operations. Many of them have the same considerations. You will need the new signs, new policies for cleaning and disinfecting. I mean, many of our pools that we clean, we're only there 3 times a week. So who's coming in behind us and who's coming in additionally on the days we're not there to help clean? What happens if after we clean? I mean, you guys all know we clean bathrooms on one visit. An hour later, the bathrooms are needing more cleaning. So we're gonna need help to come up with a plan for that. It is not our recommendation for pools to remove lifeguards and move to swim at your own risk, but if you have the capabilities of starting to open sooner than later with that, then we would talk to you personally or talk to your pool management company to start off at swim at your own risk and then start adding lifeguards if that gets your pool open sooner. We definitely cannot open pools until we get the go-ahead from the governor. Splash pads. Note the difference between your recirculating water and your single pass system. Chlorinated water does kill the virus, so those splash pads should be able to open without a problem once we get the go-ahead. The single pass system, we need to come up with a plan on who's going to wipe those down, disinfect them once people touch them. So as we've talked before, everybody kind of has their phases on how they're going to open, just like stores had a certain phase. We now are going through a phase with movie theaters opening. Pool industry are going to have a phase. This is all a suggestion, a possible, please don't, this is not in stone. Your stage 1, starting May 18th, if we get the go ahead to start training and opening pools, we could possibly start opening for lap swimming, possible reduced hours. Residents could reserve swim times online. We'd have to close water fountains and water features. Small groups, smaller bather loads. Disinfecting protocols included after each touch. Reduction of the amenities and water features, meaning we would just have to close all of them off. Health status is possible. No guests, only residents could go, but they could not bring a guest. No pool parties, no swim lessons, and no furniture. These are possible stage 1. Stage 2, depending on your pool company or how staffing looks, we could increase the bather load. Furniture could be placed out in 6 feet apart. Disinfecting protocols could change. Guest and party policies could increase so we can actually start having parties. And then health status. I don't remember what that one's for. Stage 3 or later, we still don't have a date on that, or even if we hit a stage 3, but that would be heading towards normal capacity, social distancing would be relaxed, and cleaning and disinfecting, we would still keep our protocols for that. I always like more clean objects. Operation, we are asked about billing and credits. I am sure many of y'all had questions about this. Credits will be given based on your pool company contract and billing structure for unopened lifeguard hours. Things to consider because we are currently not open and you are getting these credits back. This is not a sales pitch whatsoever. This is more of just a recommendation. Consider your additional maintenance and cleaning chemicals if lifeguards are not testing chemicals and checking equipment hourly if closure extends into the pool season. This will offset some of the credits. Expected billing for the future if for some reason we are able to open. These are the additional supplies that we would possibly need, would be mask, emergency PPE equipment, additional disinfecting supplies, cost increase for normal pool supplies, additional guards needed for capacity or health screenings, hand sanitizer, labor for additional cleaning and disinfecting, etc. Pools as well as other community vendor services require year-round maintenance. Many vendors, especially pool companies, have incurred many costs in regards to the pool operation and services. As both Heather and Josh mentioned before, we started hiring way before this all started. We started back in November once pools closed, and we were already visiting schools, spending money on advertising and recruiting. Definitely speak with your pool company on how they're handling their credits to help support their costs as well as the additions to their open hours. Consider the projects and repairs and maintenance that can be done during this downtime. You could possibly even check your future reserve studies and budget that allocates that can be completed now since you're saving money. And that can be done now between May or even early June. Consider asking your pool company or vendor to complete that work now. Things we are already looking into and we're going to start trying to figure out very soon. How will lifeguards handle kids and adults coughing? How are they going to handle fecal matter? How are they going to enforce the COVID-19 policies such as distancing or masks in addition to all their lifeguard responsibilities? How will pool companies and HOAs handle staffing challenges, including parent input, feasibility of working a shorter season? How late is too late to open your pool in regards to costs, lifeguards, and length of season? When will school go back in session? As of now, we still believe school goes back in session as normal in August, but what happens if they extend it again? This is all things to consider when talking about when to open this summer. All right, wrapping up a little bit, we want our lifeguards to work and our residents to swim and our communities to enjoy their amenities when it's feasible and we can open safely. That is our main goal, is for everyone to be safe and we feel safe opening and not have a million questions as to, well, did you open too soon? Did you open too late? Are we rushing anything? We're anticipating a opening mid-June. Obviously, if some of us can do that sooner, we will, but try to keep that in mind that we're going to do it as quickly as possible and when we feel safe. We want to work together to make this pool season work safely. Please communicate and assist when possible with supplies and staffing through word of mouth. Things are changing daily and sometimes hourly. As we mentioned earlier, the judge is making a speech as we are making this presentation. Ask your pool company for regular and frequent communication to allow us to work together to serve your client. A handful of HOA pools in the Houston area have already decided not to open the entire season for 2020. Canceling the season now kind of puts us in a bind for later if you decide to open, because we're planning to open your pool as soon as we can. So if you don't have to cancel now, we would prefer you not to, but work with us if we need to do a delay opening.
These are some of the questions that you guys submitted at the time of registration. So we're going to run through these, and then Jesus has been sending me the questions that you guys have sent to him because you're unable to ask everyone. So if you've got some of those, you're welcome to ask him, and he will funnel those over to us so that we are able to answer some of those. We know that we just presented you a lot of issues and concerns and considerations without a tremendous amount of answers, but we want you to know that we're being proactive, talking about these things and getting educated on them so that as soon as we move forward, we can say, yes, this is what we're doing, or this is what we're not going to be doing moving forward when we open based on when we open. So Darlene's going to start off with a couple of these, and Josh will hop to a few of them, and then I will finish up and we'll take any extras that come through.
Are they submitting questions on the chat? I'm not seeing them if they are.
They are. They're coming to Jesus, and he's sending. Yeah, I'll ask them.
One of the questions that many of y'all have asked is, what are the protocols for communities where there is a known case of COVID-19? Just like going to the grocery store. I mean, they're relying on you to know when you can go out. If they have a case of COVID-19, I mean, they need to self-quarantine. We're not going to be able to police it as we don't know who has it, but that's part of the signs and why we are going to recommend them be posted at your facility, is to let them know if they know they have COVID, they need to stay home. What will the disinfecting frequency and protocols be? We were just in a seminar yesterday with Red Cross, and as much as everybody would like a exact number, exact hour, how often, we can't tell you that because no one has actually written a book on what it's supposed to be yet. Each pool company is probably going to come up with a plan, and as long as it's consistent through each one, that is going to be the best protocol and it's going to be the best recommendation. What if we don't have lifeguards for disinfecting and cleaning? We are recommending that you guys as well, as an HOA, to come up with a plan for your swim at your own risk pool and work with your pool company. We're going to try to work with you guys and maybe even offer extra cleanings if need be, but that's something you need to work with each pool company. How often can the association and pool company take steps? How often can the association and pool company take steps to protect themselves in regards to liability? Coming up with a plan and following that plan will be the best step, and then also consulting with your attorney to make sure they are in agreement.
And moving on, is there a wristband distribution recommendation for long lines of people waiting to get in the pool? We discussed that before, Heather and Darlene and I. If that means if the lifeguards are asked to distribute the wristbands, again, just 6 foot social distancing, I believe. if it depending on what phase it is, I mean, we've all talked about maybe marking some areas off in regards to like using the swimming pool. So the same might be done if you're going to, to do a wristband distribution, chalk markings, whatever, just to keep those people distance apart. Do we need additional
programs? Sorry.
What's
and the possible like programs, sign up Genius, and we're looking into different ones.
Yes. And I know I've spoken to some managers who believe that they may, it's a possibility that because of the shortened season and with everything going on, I know the property management offices are closed too. I know some are considering if you have, your wristbands from last year, those will work. However, that might not get you fully collected. So that might change as well. Do we need additional chlorine monitoring at the pool? The short answer is yes. I believe we're all in agreement there. The CDC and different virologists and epidemiologists have found that the virus cannot live in chlorinated water. But as Darlene mentioned earlier, on some of our clean onlys, we're only there three times a week. And so I know I get asked a lot of times, is there a chlorine treatment? Well, most pools have a tablet feeder that we fill up the chlorine, and it dissipates as the motor runs. If that empties out in between, if we have a large rainstorm, if we have high baler loads, that chlorine is not always at the optimal level when we arrive. But when we get there, we make that correction. So we recommend, you might want to consider automated chlorine, liquid controller, something that will give you automation and can let us know. There's even systems that can allow us to check them remotely, where we know the probe can send a signal through Wi-Fi and let us know what the chlorine is at that facility. And rather than having extra visits and increasing your pool management contract, that's an option, and then we can just dispatch a tech if needed instead of additional visits. Is extra cleaning of furniture or pool area recommended? Yes, a lot of us have spoken, and even some of the municipalities that are opening, they're just putting their furniture away, and that's been the recommendation from some of the from all of the organizations that Heather mentioned earlier. NRPA, all of the different aquatic organizations. You might consider just putting your furniture away, and at least in phase one, as we covered. Pool area as well, of course, bathrooms. Again, a lot of these things will hinge on what the CDC updates us on May 15th. And why are pool safety steps and protocols so much more than stores and restaurants we see open? I'm sure everybody has an opinion on that. I know at least stores, grocery stores are considered essential. I mean, we've got to go eat, and we got to go eat. As much as all of the three of us at least depend on revenue, and we'd love to see the pools open, we do realize that swimming is maybe not as essential as some of these retail stores, restaurants, salons. I mean, we have our opinions about that. We wish that we had maybe been included in that first phase, but we weren't. So we have to live with that. Again, we do feel like the pool is safe itself, but there are concerns with contact surfaces. We mentioned slides and all of those things, but I hope that answers the question.
Alrighty, the last few, and then we'll go to the chat. So how can you control the number of people in the pool without a lifeguard or access key entrance? So this is for a swim at your own risk facilities. That short answer is you can't without an attendant. And this will kind of answer another question that was asked in the chat. You could hire an attendant, a pool monitor. Some pool companies do that currently. And then we're also going to look for people to self-police. There's an option for you to have a sign at the gate for them to be able to report someone that isn't social distancing, that wants to bring their family up to the pool and have 15 people from people that might be visiting or around the area, or maybe their pool isn't open. So you could ask people in your communication and education to have that reporting channel that they utilize if they're at the pool and they have any issues or problems. But basically you can't. If you're a swim at your own risk facility and people have access, you have to rely on them following those guidelines. One of the things that you could put out is, if we can't follow the guidelines, we won't be open. And I know there were some pools that were open before the order to close, then they were doing that. If this can't work out for lap swimming or exercising, then we're gonna move into a closure. So that's an option there. And we know that's a big challenge. Temperature checks at the gate. If you look at the news, you see stuff about Disney and Vegas and hotels taking temperature checks. Boy, is that a loaded question. We have pretty much deferred to attorneys as of right now in the Houston area, Texas. You have to make sure that you're following the guidelines. But then also I want to note that when you're in a crisis situation, or when we are operating when there's a public health threat, some things are allowed that normally weren't. We've also looked into, if you have an open wound, you can't swim, because that provides a danger to everyone else that's in that water. So some of those things are going to be things we look at. I think that temperature check will be more applicable if we're opening earlier in the recovery phase of your general geographic area. But we're gauging that, as well as health screening. I took these last 4 questions because this next question is completely applicable. Would you allow your own child to work as a lifeguard now? So I have a 15-year-old who applied last January, and oh, goodness gracious, I did it again. And he is working as a lifeguard. But it also is one of the reasons why I would like to make sure, as an operator and owner, that we are doing our best to make sure that we are not letting people with known COVID symptoms into the pool. And Aiden is my son's name, and that he's not having to provide emergency care on someone that's been sick for several days. I think that can be utilized through a lot of education, a lot of questions answered or asked at the gate through signage, a lot of working together with our communities to make sure that we say, hey, we want our pools open, so let's make sure that we're protecting each other and our staff on site. But yeah, to answer that question, he is working. We also are going to be utilizing, I know that Josh and Darlene as well will be, but we're going to be putting things out for the parents too, so that they can make their best educated decision as to how to move forward with their child's employment. But it's definitely a big question that we ask, as to how many of those are going to affect our kiddos working. We had a kid maybe 4 weeks ago say, my dad has an immune issue and I want to lifeguard so bad, but I can't this summer because we have to maintain our quarantine longer than normal people. So that's a real thing that you would look at. This next question was pushed through. I don't want to spend a ton of time on it because it's not something that any of us are doing. How are some of you training if the Red Cross has not said it was safe? So some of us are doing blended learning. At A Beautiful Pools, we're doing an introduction to the material. We're not training, DS is not training, and Sweetwater is not training in water right now. I suppose if you had access to a private facility and you were keeping your groups under 4, you could line up with what the governor's recommendation is, but that's not, that's just a suppose as well. So I'm trying to get back to the chat real fast. Sorry about me bopping around. So moving into the questions that have come through while we have been visiting. And Josh, Darlene, I'll hop over to you guys for you all to be able to give some input here as well. But one of the first questions that came up was, when we talk about hiring, does it mean that we are taking applications or putting people on payroll? We all have an onboarding process, all of us, and it is not immediate. So it takes us a while to onboard, you know, somewhere between 400 and 1,000 lifeguards every year. So we're hiring them and we are onboarding them, but we're obviously not pushing them live to give them paychecks at this time. So that is the answer to that one. The next one is, do you feel that the CDC will come out with recommended phases of opening pools, or think that it will be between the HOA pool management company? I don't think the CDC will give us phases because it is so geographically different across the United States. I think it's going to be between local and state governments, as well as the HOA and the pool management company, and the best practices as to what phase you're in, or what your community COVID levels are at the time of opening. We are going to be able to reference the CDC's recommendations in that process. Josh, for a swim at your own risk facility, if we have a monitor, reduce if we have a pool monitor to check that capacity number, how do you feel about the pool management gate attendant doing that? And is that too much liability for that pool company and or the HOA, as they won't be addressing other issues?
Was that to check capacity?
Yeah, so basically somebody that hasn't had a monitor, they hire one just for capacity numbers, but no other purpose. Is that an increase of liability because they're there?
Our attorneys have been gate monitors and pool monitors that's kind of a new evolution for us. That hasn't been very prevalent in the past, but we get more requests from developers, and that's evolving. In the beginning, we called that a pool monitor, and our attorneys have been very careful to say that's not a pool monitor, that's a gate monitor. We don't want that person to assume liability for watching the pool, so they're not a pool monitor. They're not a lifeguard that just sits at the front gate. They have duties as far as monitoring chlorine, straightening furniture, checking restrooms, and things like that. But one of those things is capacity as well. If a pool normally has 100 person capacity, and that goes down to 25, I don't think that's a liability really to say that you can only allow 25 now. I hope that answers the question.
Yeah, or to even higher. I do think that you want to be aware of, and your attorney should help you with this. What have you done historically in managing your pools? Have you had lifeguards? Have you not? Have you had monitors? Have you not? Again, we're in a crisis level of care. And so for someone to find you more liable because all of a sudden you hired a monitor to check capacity, you're actually doing a good job by being diligent. And so
yeah, I would say just be very careful. Don't call that a pool monitor, because you don't want to imply, that person is going to be responsible for the safety of the swimmers. And if you sign a contract like that, make sure that it, your pool's a swim at your own risk, but make sure that, we would make sure that we're absolved from any risk of surveillance of the swimmers.
I also wanted to note, it's been recommended to all businesses, if some of you might have been involved in this, that you have very clear board meeting minutes, how you've made your decisions, put that all in writing, make sure that your processes and procedures as to how you're moving forward are very clear. So just like you all do regularly with any minutes, try to avoid one board member making a decision or one entity making a decision, and gather all your research and document that for moving forward. That can help you. I know it's 1 o'clock, and we really will try to wrap up these next few questions in the next 10 minutes. So excuse us if we're going fast. Our contact information will be at the end if you've got any remaining. So what about grills around the pool? Are they restricted? Nothing really is restricted yet. I would remove anything that's not necessary in the first phases of opening. I don't think grills should be there. So if you look at daycares that are open right now for essential services, you're bringing your kids' own food. So I don't think group meals is a good thing to do right now. We've got a question, and Jesus, I might pop over to you. Our board chairman is suggesting we're not to open the pool at all this season. Are there legal ramifications from the homeowners for the HOA dues that have been collected if you decide not to open?
Consult your attorney. And that's kind of the overall theme. We've got just maybe another minute or so. And just a quick reminder to everyone, this presentation will be emailed out, a recording and the actual slide deck. So no worries there. But I think the overall theme from the conversation today has been, leverage the relationships you've built over years and years and years, and look to the expertise of the pool companies, the attorneys and others, the health professionals, to make the decision on whether or not to open. This is a tough time for everybody, and everything's changing. Odds are we're going to have another follow-up to this webinar. It's almost inevitable. And certainly we're here, CAI and our membership and our pool service CAI members, can assist along the way. That being said, we have probably another 10 questions in the chat. I think we'll probably cut it there, and we'll try to get those answered and sent out to everybody afterwards. In addition to that, we'll have a survey go out. So please let us know, what your thoughts are. We need to hear your feedback. We need to know what you want to hear going forward. And so, please take the time to do that. Thanks again, Darlene and Josh and Heather. It takes a lot of effort to put this together, and so we're certainly appreciative of their time. I'll let you guys, if anybody wants to say last words, and we'll go from there.
Awesome, thanks. So here's our contact information. We recommend that you contact your pool company if you have questions. We're also happy to answer questions. In March 18th, we started visiting and talking, us as well as several other pool companies. And at this point in time, none of us want more pools where we don't have lifeguards. And we want to work together to keep the Houston area safe and open our pools and provide that recreation to our residents. So I want to just say, feel free to reach out to me for an opinion without me saying, oh, let me talk about your pool contract. That's not going to happen for many of us here. And so feel free to openly visit with us if you just would like some advice or some best practice questions to ask your current pool companies. So thanks so much. And I'll let Darlene and Josh say bye.
Thank you so much for everybody coming. And yes, please get in contact with us if you have any questions.
Yes, thank you for having us too. One thing I just might add, if you're currently working with an attorney or your board, if they've made those recommendations now, please share those with us, because each facility will be different based on how the board wants to proceed. So the sooner we know those kind of things, the sooner we can tailor our service to you. So please share that input with us if you can.
Thank you, Jesus, for this platform to share.
Thank you so much.
Thank you, everyone. Have a good weekend. Enjoy your weekend. Bye-bye.